And again, in terms of my background, I'm a nurse. I've been practicing at the bedside for the last 23 years. In addition to that, I am a nursing professor at Dalhousie University and do research looking at nurses' work life, specifically nurses from visible minority groups, and currently doing a study on Aboriginal nurses. So then why do we need diversity in nursing? Of course, we've heard that nurses make up the largest workforce in the healthcare. However, we know that Aboriginal and visible minority people are underrepresented in nursing, especially when we talk about leadership positions in nursing. And then you begin to look at how we'd work across cultural boundaries if migration and globalization is changing the way our general patient population looks like. What are we doing as the largest workforce in the healthcare system to address the needs of that diverse population? I often joke with my students at Dalhousie when I start teaching. Sometimes I tell them, you know what? Dalhousie is giving you an asset here in me, that you have somebody who speaks with an accent, because when you go out there to your patient, you might be working with a patient that speaks like me, and if you learn how to communicate well with me here, that will help you as you move to the front line to speak with others. So I think it starts right from where we work, where we study as nurses. So people who experience diversity in informal interactions are better able to understand and consider multiple perspectives, resolve conflict, and appreciate both similarities and differences. So we know that if we educate nurses in classrooms that are diverse, if nurses have to work with, nursing students have to work with people that are different from them, that speak differently, that have hairstyle that look differently, they'll feel more comfortable talking to people across those boundaries. I remember the first time I had my hair in braids. I'm a maternal child nurse, and I work in labor and delivery, postpartum, and those areas. And my colleagues would ask me how I take care of the braids. So that I see those moments are teaching moments. So we can begin to have discussions about those things. So when you see your patient with those kinds of braids, you know how to take care of it. And you're not thinking that, oh, maybe they don't wash this. Maybe it's kind of dirty. But if I can have those discussions with my colleagues at the nursing station and we can laugh about it, then they'll be able to feel comfortable to discuss those issues. Because let's face it, we work in a healthcare environment that the culture is, let's not talk about race and race issues or ethnocultural issues, because it's a sensitive topic to discuss, and so we tend to leave it. But I believe that if we don't name an issue, then we cannot really address that issue, and so we need to name it.